what are the innocent heart murmurs? What is the definition? So in general, in basic knowledge, if I talk about innocent heart murmurs, so the patient who has anemia, sometimes we have patients of severe anemia, there we can appreciate the murmurs known as innocent heart murmurs. These murmurs are not because of congenital cyanotic or acyanotic congenital heart. They are because of the anemia or low hemoglobin. So if I say what is the definition of innocent heart murmur? They are the harmless sounds. I'll repeat again. They are the harmless sounds made by the blood circulating normally through the heart's chambers and the valves or through the blood vessels near the heart. I'll repeat again. Innocent heart murmur. See, murmur, we all know something known as every blood should have a streamlined flow. If the blood is having a turbulent flow, that's how they produce a murmur. Normally the blood is moving in a very beautiful streamlined flow. If there is turbulent flow, there the sound comes, that is of a murmur. So they are the harmless sound made by the blood circulating normally through the heart's chambers and the valves or through the blood vessels near the heart. Now, most importantly, for the heart murmurs, like in general, the heart murmur, they are usually appreciated in the left lower sternal border. These innocent heart murmurs, which are basically physiological or because of severe anemia, so they're usually heard in the left lower sternal border. Star mark, that was a PYQ, that these innocent heart murmur usually are appreciated at the left lower sternal border, number one. And which is very common in infancy and childhood, because in infancy and childhood, that is how we get these cases of anemias. So I'll repeat again in two. What is the take home message? The first take home message is like the innocent murmurs. Number one, they are appreciated at the left lower sternal border, and they are basically seen in the infancy and the childhood. Now, naturally, once the child grow big, automatically these murmurs, they usually disappears. Now that is why these innocent murmurs, sometimes they can be called as a physiologic murmur. There is no pathology behind, it's physiologic, or something known as functional murmur. Only the take home message right now I can appreciate is that they are best heard over the left lower sternal border, star mark. That is the previous year question.